Guide of Pregnancy After Gastric Sleeve. There are many women that wonder if they can safely handle a pregnancy after undergoing a gastric sleeve procedure. Undergoing gastric sleeve surgery does not mean not being able to go through pregnancy. This said, there are several things to be aware of when considering pregnancy after gastric sleeve. Increase in fertility. For some women, getting pregnant might have been a problem due to obesity prior to gastric sleeve. Positive results from the surgery may help individuals to become pregnant. There has been a reported link between bariatric surgery and an improvement in conditions such as polycystic ovarian syndrome, PCOS, according to the Journal of Clinical Endocrinology and Metabolism in a December 2005 issue. This can be a positive for those women that want to become pregnant, but can also be a danger for those avoiding pregnancy or those within the first 18 months of post-gastric sleeve surgery. Taking extra precautions may be necessary in the initial stages after the surgery. Allow time. While you might be excited to get started having children, it is important to remember that allowing enough time to pass after the gastric sleeve surgery is vital. The safest way to become pregnant after the surgery is to wait at least 18 months. The reason for this delay is to allow your body to adjust after the surgery and for the weight loss to become stable. Avoiding pregnancy within the rapid weight loss portion of the process is important to the health of the baby and yourself. Due to the rapid weight loss, a mother and unborn baby can suffer from malnutrition. Reaching a weight that is stable is important to ensuring that the baby and the mother are able to go through the entire pregnancy with the healthiest start. Nutrition is key. While pregnancy is certainly safe and possible after undergoing gastric sleeve surgery, it is essential that a close eye is kept on nutrition. The body of a pregnant woman will always provide the fetus with the nutrients coming into the body first. This means that the baby will be cared for first and then the mother. Since the gastric sleeve surgery decreases the amount of food that can be consumed and stored in the body, it is vital that the food going into the body is healthy and of the most use. Commonly there are several nutrient complications related to the gastric sleeve surgery, including a deficiency in iron, calcium, B12 and vitamin D. The best way to ensure that you are getting the right nutrients for you and the baby is by seeking the help of a nutritionist that has dealt with women in your situation. They can help you to choose foods that pack the most punch and give you and the baby as much as possible. Your physician will also likely prescribe a range of supplements over the standard prenatal vitamins. The provider can check your vitamin levels regularly to ensure you are getting what is necessary for you and the baby. In many cases, women who are pregnant have a reduced appetite due to nausea. The OB/GYN can often prescribe anti-nausea drugs that will help provide relief. Share information with your OB/GYN. You will want to discuss your prior gastric sleeve surgery with your OB/GYN. He or she will want to keep special attention on the growing size of your baby to ensure that he or she is gaining enough weight throughout the pregnancy. It's important that they keep an eye on how well you are doing along the way to ensure that the baby is growing properly. There may be necessary adjustments to your nutrition plans or extra help from supplements necessary along the way. When you discover that you are or may be pregnant, you may want to make sure that you find an OB/GYN that has experience working with patients that have had weight loss surgery. This could help you to get the best care possible while you are pregnant. If you have an OB/GYN already that you want to stay with, you may need to help them learn from your experience as things go along. Providing them with regular information about your condition and what you are going through could help them to better assist you and to help future patients in similar situations. Complications. All women who become pregnant are faced with the risk of several complications including pregnancy-induced hypertension and gestational diabetes. These things happen to all types of women including those that have never had a problem with their weight. Studies show that individuals that have had weight loss surgery develop these complications at the same rate as other women that have not had weight loss surgery. This said, individuals that have undergone gastric sleeve surgery may still be overweight at the time of pregnancy. This means that they could be slightly more susceptible to those complications. In some cases, women that have had problems with hypertension or diabetes and had them resolved after weight loss due to gastric sleeve surgery may find the symptoms return. Mind over matter. Women that undergo weight loss surgery often have some self-esteem issues. This can return once she becomes pregnant. The changes that the body of a woman goes through while pregnant can be difficult for those with body image trouble. Combining the emotions of pregnancy with the emotions of an individual that had dealt with obesity can make for a rocky road. It takes time for the person to get used to and deal with. In addition to the body images that are changed by weight gain during pregnancy, the individual may have scarring from the surgery that shows up more while pregnant. The worry that is associated with weight gain during pregnancy can be increased dramatically for an individual with a history of obesity. You may find that thinking about the baby before eating will help to adjust judgment. This will provide you with the ability to choose the best foods for the baby when eating. Delivery. While most women look forward to having a vaginal delivery, there may be some difficulty with this for those women that have had a gastric sleeve surgery. In many cases this is a safety measure to ensure that the baby is delivered quickly and to avoid any possible complications due to the unusual shape of the stomach. It is a good idea to discuss the delivery process and a delivery plan with the doctor as early as possible. This will help you to both be prepared and for you to educate yourself on what to expect. Having a baby after you have had weight loss surgery doesn't have to be a frightening experience. Going into the pregnancy with as much information as possible and working with a team of medical experts that are prepared to help you is essential. Take the process one day at a time and make positive decisions based on what you learn. Whether your pregnancy is planned or you are surprised, having a healthy baby after weight loss surgery is absolutely within reason and you can even fully enjoy your pregnancy. How is a pregnancy due date calculated? Human gestation is the same for everyone. It takes about 38 weeks from the day of conception to the day you deliver. Very few expectant moms know exactly when they conceived. However, even if you only had sex once during your fertile period, you wouldn't necessarily conceive right then. It's possible that the sperm hung out in your fallopian tube for a few days until your egg came along, at which point it fertilized the egg and your baby was conceived. So without knowing the day of conception, how does anyone determine a due date? Most people just estimate. The method typically used by healthcare providers is simply to count from the first day of your last period. For women with a menstrual cycle of average length, that day is usually about 2 weeks before conception, which explains why pregnancies are said to last 40 weeks. This method doesn't take into account how long your menstrual cycle actually is or when you think you might have conceived. Baby Center's due date calculator uses the same approach that your provider is likely to use. It gives you a due date that's 40 weeks from the first day of your last period. If you do happen to know precisely when you conceived, perhaps you were tracking your ovulation and you know on which day your egg must have been fertilized, we give you the option of calculating your due date based on your conception date. Your result will be 38 weeks from that date. Your healthcare provider might revise your due date if she has reason to believe it's off target. She'll measure your baby during an ultrasound exam, and if your baby is much bigger or smaller than would be reasonable given your due date, she'll provide you with a new due date. For a fun read, see our stories from parents who know when and where they did the deed that resulted in their child. Of course, a due date calculation is always approximate, whether it's from our tool or from your doctor or a midwife. Only 1 in 20 women delivers on her due date. You're just as likely to go into labor any day during the 2 weeks before or after.